Hello everyone. Now I'll be discussing question of cardiology. So we have a 41-year-old male and he has exertional dyspnea that is progressive over the last 4 weeks. Pitting pededema and distended JVP are evident on physical examination. That is very obvious that patient is congestive heart failure most likely. Let's see. Which the following substance has been increasingly produced by pulmonary endothelium in the patient? Oh, well, options are there, and now you have to tell which of these substances is released from pulmonary endothelium. Well, the answer to this question is angiotensin converting enzyme, what we normally write as ACEI. Well, this we'll never understand unless we know the basic concept, and one thing very clear, this question is one of the most important topic throughout the world. Whichever exam you appear, you are bound to get one question or two based on this particular question. So let's learn the basic concept about juxtaglomerular apparatus, what we call as JGA. It consists of mesangial cell. It consists of JG cells. This is apparatus, this is cells. What are these cells? They are nothing but modified smooth muscle of afferent arteriole. That point has to be noted very carefully. It also include macula densa, which is a sodium chloride sensor part of DCT. This is DCT and this is afferent arteriole. And one more question they ask, various combination PCT, efferent, PCT, afferent, etc. So remember it is afferent and DCT. Well, they secrete renin. Juxtaglomerular cell, I'm talking about this, they secrete renin in response to decrease renal blood pressure. And increase sympathetic tone, which is beta 1. Again, point to be noted. That means even beta sympathetic chain has effect on the JG cell also. Now, macula densa, which is the part which is a decrease, this is senses decreased sodium chloride delivery to DCT, and this lead to increased renin release. Now, what is the function of renin which has come? Renin causes efferent arteriole vasoconstriction. This is via angiotensin 2. Okay, what and how it is going to make angiotensin 2, I am going to tell you in the next slide. But it is the angiotensin 2 which is going to cause efferent arteriole vasoconstriction. Noted, it is efferent. Efferent arteriole vasoconstriction will cause increased GFR. And juxtaglomerular apparatus maintain GFR via renin angiotensin aldosterone system, what we call as RAAS. Okay. Now let's look into beautiful picture of juxtaglomerular apparatus. It consists of, first of all, afferent arteriole, which are JG cells. Then they come macula densa cell, they are the part of DCT. You can see this afferent arteriole. This is the DCT, and finally the supporting cell are mesangial cell. These three together, they constitute juxtaglomerular apparatus. And what I told you, ultimately it is this was the afferent arteriole, this is the efferent arteriole, this one. So it is the efferent arteriole which we are constricted by angiotensin 2, or I can say angiotensin 2 causes vasoconstriction of the efferent arteriole. And now what is going to do? Let's learn more about this thing. So renin is getting released from the kidneys. The point I told you in the previous slide, right? So this was due to decreased BP. Anything decreased BP will stimulate JG cell to secrete renin, decrease sodium delivery in the macula densa, the point I mentioned, and increase sympathetic tone by beta 1 receptor. This also I mentioned to you. So there are three reasons why renin will be secreted. Now this renin will convert angiotensinogen, which is coming from the liver, and this convert angiotensinogen into angiotensin 1. Now, lung endothelium, they secrete ACE, and this will convert angiotensin 1 into angiotensin 2. So now you can see there are three important molecules. One is renin coming from the kidney, angiotensinogen coming from the liver, and angioca ACE is coming from the lungs, right? So now angiotensin 2 has been made, and we learn what the action it is going to do in the kidney is going to cause efferent arteriole vasoconstriction. So let's learn more about each of these molecules in detail. So we have a renin secreted by juxtaglomerular cells in response to decreased renal arterial pressure, increased sympathetic discharge beta 1, and now beta blocker can decrease BP by inhibiting beta receptor on the JG. They cause decreased renin release. This point is not known to good amount of people are not aware that beta blocker have a action in the renal also by renin mechanism by decreased renin secretion. Well, angiotensin 2, it helps to maintain blood volume and the blood pressure. It is a potent vasoconstrictor. Okay, constrictor. Now I have a question for you. Question is, it is a very potent vasoconstrictor. Now tell me which is the most potent vasoconstrictor in the body. Stop the video, write down the answer in your copy. What is the most powerful vasoconstrictor in the body? Well, answer is endothelin. Okay. So now we got angiotensin 2. So it acts on the angiotensin 2 receptor on the vascular smooth muscle, and that lead to vasoconstriction, and that lead to increased BP. Okay. And when we use ACEI, they reverse this action and they lead to vasodilatation, BP falls. This is the basic mechanism of action of ACEI. Well, angiotensin 2 also constrict efferent arteriole of the glomerulus, and that lead to increased filtration factor to preserve renal function, especially when the renal blood flow is reduced and the body want to maintain GFR. This is by efferent vasoconstriction. Okay, how come? Let's learn. Let's say this is the afferent, and these are the capillaries, and finally it is the efferent is there. This is normal. They are the glomerulus. Now this is the afferent, is the efferent. Now when angiotensin 2, this is the afferent remain like this, glomeruli, and now efferent has constricted. So now the efferent has constricted. Look into this diameter and this diameter. So definitely when this passage is narrow, that will lead to increase pressure in the glomeruli, and that will lead to filtration. Simple physics. Now, well, everyone knows that angiotensin 2 are the very, very important part in taking part in stimulating aldosterone, and they lead to increased sodium channel activation, that lead to sodium and water reabsorption is there. Then many of us are not aware that they even stimulate posterior pituitary to secrete ADH, and that lead to that acts on the aquaporin, and that causes increased water reabsorption. The point to be noted, angiotensin also stimulate ADH release from posterior pituitary. So we learned that in DCT they are acting via aldosterone, but they also have an action in PCT, and they cause sodium reabsorption. Okay, sodium reabsorption, and that can permit contraction alkalosis also. And finally, they stimulate hypothalamus and they stimulate thirst also. So in addition to action in kidney, there are so many other action also angiotensin 2. Now let us look into other option. Aldosterone, it is we know very well it is secreted from zona. glomerulosa from the adrenal gland. It's not coming from the lungs, and it regulates sodium and water reabsorption. It responds to low blood volume state. ADH, it comes from posterior pituitary. It only absorbs water. ANP, BNP, they are released from ANP is released from atria, and BNP is from ventricle of the myocardium. They are secreted in response to increased volume. The main action is natriuresis. So they keep a check on renin angiotensin. We are well aware this RAS system, so-called renin angiotensin aldosterone system, they tend to absorb sodium and water. And who will keep a check? By ANP, BNP. Once the extra sodium water comes in, ANP and BNP are released, and they lead to natriuresis. They relax vascular smooth muscle via CGMP, cyclic GMP. They increase GFR, they decrease renin, and they dilate afferent arteriole. Point to be noted, angiotensin was causing efferent arteriole constriction, and this is causing, they are dilating the afferent arteriole, and they constrict efferent arteriole, and that's why they are going to increase GFR. Point to be noted very carefully. So golden line to remember, juxtaglomerular cells, they secrete renin in response to decrease renal blood pressure, increase sympathetic tone beta 1, macula densa, decrease, they sense decreased sodium chloride delivery to DCT, and it lead to increased renin release. Ultimately, both are going to cause increased renin release. Thank you very much.